Thank you. Thank you. And I can only second what you have been saying because I think Serbia is in a similar way positioned as other countries. So we see the same challenges. So continuing with our presentation, just a short overview, more or less the epidemiology is similar as in countries that have been presented before. So we do have a very high incidence both in male and in female. And of course, we have been seeing an increase in lung cancer in Serbia in the females, especially in the non-smoking population, which leads us to believe that there are other factors that are contributing to this, as the high air pollution that's seen in this area. So it's really an issue that we need to address. Respectively of some data that have been published in the last years about the situation in our country. So we need to address the tobacco abuse, we need to address the gender differences, and what we want to do is also to increase the availability of drugs and the availability of the drugs that we already have in different stages. So for now, we do have immunotherapy inhibitors for ALK and for EGFR, but of course, we would like to have them in different settings as well. So there's a lot to do. And what we want to achieve is actually to, of course, both reduce the incidence and, of course, contribute to the better treatment of our patients. So to reduce the incidence, but also to reduce the very high mortality that we still have. It's still the #1 killer in Serbia. So considering the implementation of screening and early detection, this is something that we have seen in many conferences so far. So it's in countries with high incidence that actually the screening programs are still not implemented as well as we would have liked them to. And in Serbia, it's a similar situation as well. So where are we now? There's a lot of things that are being published at the moment for our regional screening pilot project, which now is at its 5th year, and we are very proud of it because it was the first national effort that happened, according to our government, only in our one part of our country, but now it has been implemented in the remainder of the country. But for now, these are the hard data that we have. So this was the 3-year cutoff. And I think they're doing pretty well because they have been assessing various factors of the screening program, and our radiologists are working tirelessly to cover all the possible regions. Anna has addressed the issue of vulnerable population. It's similar in Serbia, and we are trying to have the screening available in different parts of our country and in different ways, because you need to approach each of these populations very carefully to get the kind of coverage of the screening that you would like. So what we have seen in the 3-year cutoff is really the shift towards stages 1 and 2. This has been really, really well for us. Hopefully, we will see it also in the nationwide program that has piloted in 2024. So this is the 5-year cutoff that we have seen. So far, the target population was 33,000, and around a third of that, 31%, has been screened so far. And we had 4.7 positive findings. And you see that some of them have refused follow-up diagnostic evaluation. This is something that I would like to highlight here as one of our main implementation challenges. And it also addresses the issues that you have just spoken about, that we need to work really a lot on the education of our population, on speaking with them in any possible event, and talking about the positive effects of the screening and not about the fear of the radiological aspects. So we need to address both the patient vulnerability factors and our system level factors, which we have encountered, and I'm quite sure that it's similar in other countries as well. So we need to work on so many levels, but the shift is obvious, and of course it will pay off. This is the national screening program that has been piloted in 2024. No hard data has been published yet, so nothing to present so far. But as we are in close contact with our colleagues that are working not only in the region of Vojvodina that was presented before, but in whole Serbia, hopefully soon we will have some results to present, perhaps next year. So not like in Croatia, where the GPs are involved and where the program is working very well. We do it centralized, so it does derive from Belgrade and from our National Center for Treatment of Cancers. But I think it works very well for now. And of course, there are strategies to use the knowledge that you have presented today from our similar countries that are surrounding us, and of course, to work together to find better ways for implementation. My part of the story as a biochemist and a manager in the healthcare system is to find ways to implement this screening. This is me sometimes in the night when I'm thinking about all the factors that we need to address to have the early detection and screening implemented very well in our country, because it's not only about education and factors that influence the follow-up, but it's also about finances, about organization, and about so many things that we need to carefully do so the screening program will actually be implemented in our country in a good way, that it's sustainable, because this is the key, that we have it well positioned in our healthcare system. So there have been a few initiatives at the national level, and I think our main advantage is that we are a rather small country working very well. So we have initiated a collaboration between an ESMO-affiliated and EACR-affiliated societies, national societies of researchers and clinicians that will work together. We started this in 2025 because we want to also couple molecular methods that would complement the radiological methods that would be done from blood at the time of screening, that we actually would like to help our colleagues in the clinic to pre-screen, complement the methods, and to make the whole process easier. Also, of course, these alternative methods for some kind of implementation in the healthcare system will aid us to advance the science behind the screening and to help our citizens to know that we are doing everything we can to prevent this very high incidence of lung cancer in our country. Also, beside the national efforts, we have a lot of international efforts. I would like to highlight our very good early detection and screening committee of the I-ELCAP. Many of you who are sitting today in the room are members of this committee. I think we are working very well. We have one ongoing project that's concerning the individuals who have never smoked. And of course, all our countries are contributing both with data and with expertise to advance all these programs. This is our team in Serbia, and of course, the regional pilot program in Vojvodina is led by colleagues from Sremska Kamenica and Novi Sad. And I would like to highlight that we are all available for any questions, for any collaboration in the region and in Europe, and that we would be very happy to advance all these programs. I'm very sad that I could not be with you today in Gdańsk, but hopefully for the next Agile Congress, we will be together in person somewhere. So thank you very much.